I'm Thomas Senghas. I'm dentist in Hamburg. I have an office there with my wife, and I work for 6 years now with Teneo. What I like best about my Teneo is the motorized headrest, that I can change the head position of my patient any time of my procedure. Another nice feature I appreciate is that the side delivery comes to me whenever I want it, and everything is automated, so that means in the beginning the setup of Teneo is done by itself and I can concentrate on my patient. My patient is in a very comfortable position, and the very moment I address the tooth of my patient, you can see instead of bending over with a tip against the foot switch, I can change the headrest and I always have an upright position. All the treatment I do on the patient is integrated. So whatever I want for endodontics, implantology or anything else, we have it integrated, and we don't need to switch to another component or put some extra wires or an extra foot switch. So all this is done by the only one foot switch we have. And I personally appreciate also that I do it hand-free. So all the control here goes by foot switch, the change of the values of motor, change of files during the endo features, and especially if you do implantology, I don't want to touch anything because of infection control. I love to do that with my feet. What we love in Germany, that we have a split way for the assistant to work. She's sitting and dressing directly to the patient, and with her left hand she takes out the suction system direct way to the mouth, so there's no turning around of the horses. And with her right hand she can support me with the material from over here. So that means the assistant can help me with a maximum of her two sides, and it's easy for her to address the patient directly without twisting her body. And that means for both of us we have a very upright and ergonomic positioning. As one of my main emphasis in my dentistry, I have endodontics, and I like to have everything integrated with the endodontics. I have the apex locator in here, and as soon as I activate my apex, I have it on the monitor up there, I have it on the display over here, so it's all I need for my treatment. And once again, it's the same foot switch, it's no extra component, so that is really what a dentist who also does endodontics loves. My patients really love this soft and comfortable upholstery of Teneo, and even if I turn their head to the side so it's easier for me to reach the tooth, they like being on this headrest because it's soft and smooth, and all the maneuvering with a motorized headrest, it's comfortable to the patients. I like that I can sit underneath the chair and move my position always according to the treatment on the tooth. So I never want myself to be bent over, and therefore I have to sit underneath here. At the same time, the patient is in a good posture for himself, so it's comfortable for him. I like my patients to be comfortable because I want to give the feeling to them they're well sheltered in my office. This actually is not a dental chair, it's a treatment center because you have got everything integrated in there. That means for me, my work and my workflow is more fluent, and I don't have to switch around, I don't have to put any extra components to it. I have only one foot switch, and during my work that means it goes quicker, faster, and less moving around, so that also is nice for the patient. I believe that Teneo really is the next level of ergonomics, and if you ever work with this Teneo, you will feel the pleasure of sitting up in an upright position, having everything integrated, controlling everything with one foot switch, and feeling really fine during your procedure.